ahead and go in and meet Miss Johnson. All right, here we go. Hi, Miss Johnson. My name's Tamara. I'm going to be your nurse today. I'm so sorry to hear about your fall, but don't worry, you are in good hands today. We're going to take care of you. So I need to do some assessments, and I brought my students here with me today to help me take care of you. And so we're going to have some questions to ask and make sure that everything is okay with you before you go for your surgery in the morning. So, all right, class, here we are with Miss Johnson. What do we need to do? What are some priority assessments or cues that we want to do with her? So we want to assess neuro, and in particular, what do we want to assess? We have to think not just neuro, but vascular. So neurovascular checks, because she fell and fractured her hip. We're all on the right track. So we're going to check, we're going to listen to the bowel sounds. Now, does immobility have any effect on your urinary system? Yes, it does. So we want to make sure, is he continent or not? And then we want to look at color, clarity, smell for the urine, because we know that when a client is immobile, then they might have urinary stasis, and it puts them at higher risk for UTIs. Excellent, Scott. Anything else? Done. Respiratory, we've looked for clots, thrombus, DVT, we've assessed bowels, urine, we've assessed skin colors, peripheral pulses, look for edema. We want to assess nutrition as well, right? We did an skin integumentary assessment, absolutely. All right, and again, I think I just said it, but we're going to go back to the nurse's station as I talk about it. Thank you, Mr. Horton. We'll be back in a little bit to check you out. Or to prioritize everything and what our top threes would be for this client based on our ABCs. Our big concerns are for somebody who's immobile is that pneumonia, thrombus, pressure injuries, or risk for falls. Those are our big concerns there. I'm going to take you back to clinical to show you some of these things too. So we want to make sure that we turn Mr. Ivan, right? And Mr. Horton. We're going to keep him incentive spirometer. I sure have that for him right now. Here we go, Mr. Horton. Here is your incentive spirometer. Every time a commercial comes on, I want you to utilize your incentive spirometer. And we would give him full education on how to use it. Absolutely, Bailey. We got to get out our compression stockings, our compression socks, and make sure that he wears these to help with that return. We're going to reposition every 2 hours minimally. And also, if you notice, I have a nice pillow underneath so that we can try to make sure that we promote comfort and keep the heels off. So no pressure on those heels. Converse with the client. Absolutely. We want to encourage visitors so he doesn't feel alone. We want a nutrition consult. Laxatives if needed, or if it gets really severe, yep, you got it. Could be an enema, but only in severe cases. And of course, we're going to listen to the lungs. We're going to monitor all of those things. The vital signs, listen to his lungs and ensure that he's not developing anything. All right, great job, guys. See you later. Make sure you drink up plenty of water.